Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Rockne Hymel, a radiation oncologist at Terrebonne General, Bird Perkins Cancer Center. Today, we're going to learn more about his training and experience in radiation oncology and what he looks forward to most in his career here. Welcome to the show, Dr. Hymel.
Thank you.
All right, well, let's get started with you telling us a little bit more about yourself and your role at the Cancer Center.
All right, so I'm from Destrehan. I grew up there. I went to high school in New Orleans, and I went to medical school at LSU New Orleans, and did my radiation training at the Medical University of South Carolina in Charleston. And then since then, I've been working in Baton Rouge for the last few years before coming here.
Okay, so you're back home, came
Yes.
full circle, pretty much. So what inspired you to pursue a career in radiation oncology?
I initially wanted to be a surgeon, but in medical school, I decided that I really enjoyed working with cancer patients. I felt like I was really able to make a difference, and I really enjoyed the continuity, getting to know people, working through problems, and taking them through this process. And I found radiation oncology a little bit later, which allowed me to use technology, more precise, individual, tailored treatments, and I kind of settled on that.
Okay, and can you tell us a little bit about your experience and training in the radiation therapy?
Sure. So, radiation oncology is using targeted X rays to treat cancer, and we're able to focus individually on tumor cells with targeted treatments that are individualized for each patient. And we use that with a radiation machine that we have in the cancer center, delivering treatments there, and we treat all types of cancers.
Okay, and what do you do as a radiation oncologist?
So, when someone has cancer that could be treated with radiation, we meet them in the first place to kind of discuss, their particular situation, what we can do, the ins and outs of treatment, and then we just start designing their plan, which is based just for them. And then we take them through the treatments one day at a time for usually a few weeks, and then once it's all done, we guide them through the process afterwards.
What would a typical course of treatment for a radiation patient be like?
So generally, we would do daily radiation treatments Monday through Friday, usually about 20 minutes a day. And most people, it ends up being between 4 to 7 weeks of treatment. That varies obviously by type of cancer, by person. And it's usually you're in and out pretty fast. You don't have to stay in one place for 4 or 5 hours. And we can kind of work it into most people's days.
How do you envision contributing to patient care in the radiation oncology setting?
One of the main reasons why I wanted to come here was to be able to deliver high quality cancer treatments for patients closer to their homes. I understand that there's such a wide catchment area that we are able to contribute here, and to avoid patients having to go 2 or 3 hours further from their home, I'd like to be able to give state of the art treatments here in the community.
All right, and tell us a little bit more about the technology at Terrebonne General Bird Perkins Cancer Center.
So we have one of the most state-of-the-art linear accelerators, which is the radiation machine, and we're able to give essentially almost any kind of radiation treatment possible, from the smallest to the largest tumors, any kind of cancer treatments with very precise accuracy.
Okay, and how do you stay current on the latest advancements in cancer care?
Well, everything is constantly changing, and luckily now in the modern technology, we have podcasts, emails, ways that we can kind of keep up with all the changes that are happening. Besides going to annual meetings, just really try to stay current because things change all the time, and there's weekly things that come out, and just got to stay up to date.
Right. And at the Cancer Center, their clinical trials are offered. So, are there any specific research or clinical interests that you have and you're hoping to pursue in your new role?
Really anything in general, but I think I'm really interested in pursuing things like focused radiation for lung cancer, where we can incorporate that with immunotherapy. That's something that we're looking at right now. And then I'm kind of open to just about anything, especially more advanced ways to treat breast cancer. Those are kind of the big things I'd like to focus on for now.
Okay. And what would you like your patients to know about being treated with radiation?
Sure. So a lot of people are scared of radiation. It can be kind of a taboo thing. People are used to the radiation side effects of the 60s and 70s, and things have come quite a long way since then. So, one of my main goals when people come in for the first time is to let them know what radiation is, what it isn't, kind of remove the stigma and the scariness of it. It's different for each person. And, we need to just discuss what can and can't happen, and to know that we're there to guide them each step of the way for their treatment.
Okay. And are there any other services that the Cancer Center offers to help patients through their journey?
Sure, we have a great setup in the radiation clinic because not only do people get their radiation treatments there, but we're also able to provide dietary nutrition services, cancer survivorship, where we are following along once people have completed their journey, um, and then social services. We can do a lot of things.
Okay, so comprehensive care for the
Exactly.
patients. All right, and share with us some more of your goals and aspirations as a radiation oncologist.
Sure. So since I'm new here, I'd like to, become well known in the community and build up trust amongst all the other referring doctors and really be someone that we can look forward to delivering good quality radiation treatments, both now and in the future, evolving with the times, and just being somewhere we can trust.
All right. Well, thank you so much for joining us today and good luck with your practice.
Thank you.
For more information about Terrebonne General Mary Bird Perkins Cancer Center, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.